I am the executive director of the Platelet Disorder Support Association, which is a rare disease patient advocacy organization. But I also have two rare diseases, and so obviously this week is very, very near and dear to my heart. I just wanted to take a few minutes to share my story with you, and I think a lot of you will hear a lot of familiar themes in my experience. I was, back in 1996, about 5 months after the birth of my second child, I woke up one day and I had debilitating fatigue. And it was more than new mom fatigue. I have a toddler and a newborn baby. It was like somebody flipped a switch on me. And I also had some very strange, vague neurological symptoms. And so like most rare disease patients, I saw numerous doctors, I had numerous tests, and initially I was told I had MS, and then I was told that was a misdiagnosis. And at the end of 3 years, I was told there was nothing wrong with me, that it was all in my head. So a couple months later, my husband and I were out of town at a family wedding with our children, and we were dancing and having a good time, and at the end of the evening we went back to our hotel room and I sat down on the end of the bed, and my husband came over to unstrap my high heels, and he said, "What's wrong with your feet?" And I looked down and it looked like I had a rash all over the top of my feet and my ankles. I would later learn that I had what's called petechiae, so I had blood leaking into my capillaries in my feet. But of course, at that time, I thought, well, one more weird thing to add to the list. And so the next day, I bumped my arm, and within minutes, I had what looked like a softball-sized bruise or hematoma on the side of my arm. So when we returned home on Monday, I thought, well, maybe I better put a call into my primary care physician, which I did, and they said, we can get you in about 2 weeks. So as it turned out, I got a call later that afternoon, and they said we had a cancellation if you want the 5 o'clock appointment. So I went into the doctor, and at that point, the rash was completely gone, so there really wasn't anything to see. And the doctor said, well, let's send you in for some blood work. So I went and had some blood work, went home, and that night I got a call at 3 o'clock in the morning, and the doctor said, Mrs. Kruse, this is Dr. Jones. I'm on call at the Cleveland Clinic. You need to get to the emergency room immediately. You have a platelet count of 3,000. And if anybody knows anything about a platelet count, normal is about 150,000 to about 400,000. Now, the interesting thing is I had been a radio and television producer and reporter for about 20 years, and I had been a health reporter. And of course, the only thing that I knew associated with a low platelet count was leukemia, so of course that's what I'm thinking. But at any rate, it just so happened that my husband was out of town, and I had a 3-year-old and a 6-year-old sleeping in their bedrooms. So I said to him, well, you know what, I'll come in the morning. And he said, no, it cannot wait. He said, do not take a shower, do not brush your teeth, do not shave your legs, you could bleed to death. So fortunately, my parents lived close by, and my mom came and stayed with the kids, and my dad picked me up and went to the emergency room, spent 3 days at the Cleveland Clinic, had numerous tests and a bone marrow biopsy. But what's really interesting about that is you're very scared and you're anxious. And I had this resident come in, the first couple of hours that I was in the emergency room, and I said, do you think I have leukemia? And she said, no, you probably just have this condition called ITP, and all you do is take a pill and it goes away. So that actually at the time made me feel a lot better. What I didn't know is that I would spend 3 years on massive doses of prednisone. I'm sure lots of folks out here have been on prednisone. I would eventually have my spleen taken out. I had numerous hospitalizations, and we always talk about riding the roller coaster of ITP because your platelets can drop within like a 24-hour period. So I was going in for blood tests sometimes multiple times a week. So fortunately for me, with my connections and my health background, I was able to, because nothing was working for me, none of the treatments were working for me, and there weren't really a lot of options out there. They were talking about doing some chemotherapy drugs, they were talking about doing some off-label drugs. So I was able to, I decided to take control of my own health situation. I became my own best advocate. I went out there and I found some treatments, talked to some doctors, and ended up going into remission. So I've been in remission now for 14 years. Thank you. But then, 5 years ago, my husband and I and the kids were out of town again. Maybe I shouldn't go out of town. We were on vacation, and I had a fever. And because I don't have a spleen, I'm very immunocompromised. So called the doctor, and he said, maybe we should run some tests just to make sure it's not a bacterial infection. And for whatever reason, he decides to check my immunoglobulin levels. And they find out that I have an immune deficiency. And this is what actually caused my bleeding disorder. But I went back through all my medical records, and I found out that they actually tested me for this right before they took my spleen out. So I should have never had my spleen out. But unfortunately, I had had a treatment that skewed the test results. So the doctor just didn't catch it and didn't realize I had the immune deficiency. I am now on a lifelong plasma treatment. Every 6 weeks, a nurse comes to my house and gives me a 6-hour infusion. Each treatment costs $12,000, over $100,000 a year, and it's something that I'm going to have to be on for the rest of my life. However, I'm very fortunate because it protects me from getting really sick. I'm relatively healthy, and my husband has great health insurance, although he would like to retire in a couple of years, and I keep telling him that's just not going to happen. I'm also very fortunate because I have met so many wonderful people in the rare disease community, in the platelet disorder community, so many courageous people, and this is a job that I just love and I'm so passionate about. And actually my daughter Alex is sitting here in the front row, and she is applying to medical school and she does rare disease research. So maybe she'll be able to help someone in this room one day. So everything happens for a reason, and I'm just really happy to be here.